Hi, I'm your pharmacist Sarah. Today I would like to demonstrate how to use MDI inhaler. Priming of MDI inhaler. Hold the inhaler in an upright position. Remove the cap. Shake the inhaler. One shake, go up and down. Shake well for 5 times. Press the inhaler to ensure visible aerosol propelled for new inhaler or has not been used for some times. Hold the inhaler in an upright position. Remove the cap. Shake the inhaler. One shake, go up and down. Shake well for 5 times. Exhale slowly and completely through mouth, away from the inhaler. Place the mouthpiece between teeth without biting. Ensure the lips are sealed to the mouthpiece. Breathe in slowly through the mouth, at the same time press down firmly on canister. Keep breathing in slowly and deeply. Remove the inhaler from mouth and hold breathe for 5 to 10 seconds. Breathe out gently, away from the inhaler. If additional puff is needed, to wait for 30 seconds to 1 minute. To repeat from the step shaking of the inhaler. After using, wipe the mouthpiece with dry cloth or tissue. Replace the cap. Gargle the mouth and throat after using inhaled corticosteroid. How to clean the MDI. Remove the canister and cap. Clean the plastic parts of inhaler by rinsing under running tap water for 30 seconds. Air dry the plastic parts. Do not wipe it. Reassemble the inhaler. Keep in dry place and away from direct sunlight. Dose checking. Mark the date of opening on the new inhaler or to check with the dose counter.